So, good morning, respected judges. I am going to speak on a study where the role of convergence insufficiency is assessed in cases of children without refractive error. Not moving. Not moving. No financial interest. So, headache is one of the most common symptoms of children seeking medical attention, and mostly during COVID period this has increased. So, ophthalmologists are usually asked to evaluate children with headache if there is any refractive error present or not. Mostly the headache is because of refractive error and binocular vision and abnormalities. Convergence insufficiency is a common dysfunction of binocular vision and a major cause of headache which goes undetected. So, our objective of the study was to evaluate the association between convergence insufficiency and headache in children between 5 to 16 years of age without any refractive error. This is a cross-sectional hospital-based study. Institutional ethics committee approval and informed consent were obtained. 85 children with complaints of headache without refractive error who either had come by their own or were referred from other departments, mostly pediatric department, to the Department of Ophthalmology. Age above 16 years of age, uncooperative children, strabismus, inflammatory ocular disease and trauma cases were excluded from the study. Sample size was calculated based on the formula for prevalence study, and with design effect of 10%, we get the sample size of 85. So in all cases, visual acuity was measured in each eye and refraction was done, and all the children with refractive error were excluded. Slit lamp and fundus exam was done to rule out ocular pathology. Orthoptic test mostly done for both near and far, and near point of convergence was measured by RF ruler. So convergence insufficiency is defined as near point of convergence more than 10 centimeter. So SPSS version 25 was used to analyze the data. So these are the results. So majority of the patients were females, 52.94%, and males 47%, and this difference is also significant. There was an abnormal near point of convergence in 43.53% of headache patients, and it is more in aged children, that is more in the group of 13 to 16 years, 55.56%. So the association between headache and near point of convergence is found to be statistically significant by chi-square test. So there are many studies done previously with prevalence varying from 4% to 26 to 28%, but in our study it is 43.53%, and the higher magnitude of convergence insufficiency in our study may be because of very selective about inclusion of only symptomatic cases with history of headache. We excluded all other. So to conclude, all children with headache, even with normal visual acuity and normal refraction, should undergo a detailed orthoptic examination, and it should be included in the school eye health exam program. So, but the limitation of our study was its little small sample size and incomplete orthoptic examination. We recommend an analytical study with larger sample size and complete orthoptic examination for establishing the cause and effect relationship between convergence insufficiency and headache. Thank you.